At 85 years old, this wise doctor reveals the 6 most common itchy spots seniors experience and why they could be silent warnings of hidden health problems. Don't ignore these bodily signs. Today, I'm going to share 2 crucial pieces of information. First, the 6 dangerous areas where itching might signal cancer, and second, simple self-diagnosis tests you can do right in your own home. If you're experiencing any unusual itchiness right now, please pay close attention. Let's begin with 1. The lower leg, especially the front of the shin. If you're constantly experiencing itchiness there, it's vital to consider lymphoma. When the lymphatic system, a key part of your immune defense, becomes inflamed, it releases inflammatory substances that can irritate peripheral nerves, causing persistent itching in the lower legs. This particular itch feels different from your everyday dry skin or eczema. Remember Mr. Johnson, the 75-year-old man I mentioned earlier? For 3 months, he endured intense itching on his lower legs. It started intermittently but gradually became severe, waking him up nightly around 3 a.m., so unbearable he couldn't sleep. What struck him most was that scratching only made it worse, offering no relief. He initially suspected poor blood circulation and tried massages, warm compresses, even compression socks, all to no avail. His worried wife bought expensive lotions, but nothing helped. Here's a simple at-home check. Apply moisturizing lotions and anti-itch creams faithfully 2 or 3 times a day for a week. For common skin problems, this usually provides relief. However, if the itch is due to lymphoma, these treatments won't work, and the itching may even worsen. Another telling sign is the timing. Itching related to early-stage lymphoma often gets worse at night. It might seem fine during the day, but flares up when you lie down, possibly because lymphatic system activity increases at night and its cycle slows when you're horizontal. Importantly, this kind of itch cannot be resolved with creams or antihistamines because it stems from an internal immune system issue. If your lower legs have been persistently itchy for over 3 weeks and creams haven't helped, please see a blood oncologist immediately. Fortunately for Mr. Johnson, his condition was caught early, treated successfully, and he is now completely healthy. Early detection of lymphoma boasts an impressive 90% treatment success rate. Have you noticed any strange, persistent itching around your lower legs lately? Next, let's discuss 2, the middle of the back. This area holds a surprising connection to your pancreas. The pancreas is intimately linked to nerves in the back, meaning that problems with this vital organ can manifest as signals there. In the early stages of pancreatic cancer, when bile flow is disrupted and moves backward, it can stimulate these connected nerves, leading to a persistent itch in the mid-back. This phenomenon is known as transferred pain, where the actual problem lies in one place, but the symptom appears in another. I recall Ms. Williams, a 68-year-old patient who came to me not long ago. She had tried everything to relieve a constant itch in one specific spot on her mid-back. Thinking it was her bedding, she replaced her mattress, then her pillows and blankets, and even conducted a thorough house cleaning to eliminate mites. She tearfully explained, "Doctor, we turned our house upside down, threw away rugs, even replaced couches, but that one spot still itches." She consulted dermatologists, received allergy tests, and applied various creams, all to no effect. Ms. Williams described a distinct pattern. The itch was fine all day, but consistently started after dinner, regardless of what she ate. Here's how you can check at home. Gently press the itchy spot in the middle of your back with your finger. If the itch is pancreatic related, you might feel a peculiar heaviness or discomfort beneath the surface, different from a normal skin itch. Also, consider your digestion. The pancreas is crucial for producing digestive enzymes. If your back itchiness is accompanied by persistent poor digestion, especially after consuming greasy foods, this warrants immediate attention. Many people mistakenly attribute mid-back discomfort to a simple muscle ache or strain, applying pain patches or seeking temporary relief from massages. But if the itch persists and your skin appears normal, please do not dismiss it. Get a professional checkup. Have you recently experienced unusual sensations on your back? Now let's move on to 3, the scalp. An itchy scalp can sometimes be a unique symptom of leukemia. This occurs when an overproduction of white blood cells leads to inflammatory substances that stimulate the tiny nerves in your scalp, causing itchiness. This is especially noticeable behind the ears and on the neck. Mr. Harris, a 73-year-old patient, made a lasting impression on me. He was meticulously detailed, even journaling for 3 months, recording precisely when his scalp itch started and when it worsened. He initially blamed his shampoo, switching to milder varieties, then skipping conditioner, and even trying a bar of soap. He experimented with washing his hair every other day, but nothing worked. Curiously, there was no dandruff or visible redness on his scalp, just an unrelenting urge to scratch, particularly behind his ears. Even more strangely, he didn't feel it during the day, but it became unbearable once he lay down. Here's how you can do a home check. Gently feel your scalp. If the itch is related to leukemia, that specific itchy spot might feel slightly warmer than the surrounding areas due to minute inflammatory responses. Pay close attention to the pattern of the itchiness. Leukemia-related scalp itching often intensifies at night. Like Mr. Harris, it might be absent during the day but flares up when you lie down, possibly due to changes in blood circulation that spread inflammatory substances. Furthermore, be alert for accompanying symptoms. If you've been feeling unusually tired lately, or if small cuts heal slowly, or if you're experiencing unexplained bruising or bleeding gums alongside your itchy scalp, it's imperative to seek medical advice promptly. Have you noticed a strange itchiness around your scalp or neck recently? Our next area is 4, near the chest. Itchiness here, particularly in women, but also possible in men, could be connected to inflammatory breast cancer or, in rare cases, male breast cancer. This type of cancer might not present as a palpable lump like other breast cancers. Instead, the lymphatic system in the breast can become blocked, and cancer cells stimulate the skin, causing it to take on an orange peel texture, frequently accompanied by intense itchiness. I recall Ms. Davis, a 69-year-old patient who came for a checkup a few months ago. She meticulously described an itch where her bra band typically rested, naturally assuming it was a bra issue. She tried bras made of cotton, silk, bamboo, and even went braless or wore loose clothing, but the itch persisted. What was peculiar was that the itch was confined only to her right breast, with her left side being perfectly normal. Here's how you can check at home. Stand in front of a mirror and closely examine both breasts. If one breast shows a noticeable difference in texture, seems slightly swollen, or has any subtle color changes compared to the other, be cautious. Ms. Davis, for instance, had a distinct redness on her right breast. The starting point of the itch also matters. Inflammatory breast cancer often begins around the nipples or beneath the chest, especially if the itch is concentrated on one side. Initially, it may present as a simple itch, but over time, the skin might thicken or visibly resemble an orange peel. If you press on the skin, it may lose its elasticity. This is relevant for men too. While male breast cancer accounts for only about 1% of all breast cancers, it's a reality. If men over 60 experience nipple area itchiness, they should get checked. Crucially, if there are no lumps you can feel, but the skin shows deformity or persistent itchiness, please get checked immediately. Inflammatory breast cancer can spread more rapidly than other types, but like all cancers, early detection drastically improves treatment success. Does anyone here have persistent itchiness around the chest area? Moving on to 5, near the anus or reproductive organs. Persistent itchiness in these intimate areas could be a sign of anal cancer or vulvar cancer. Here, a tumor can compress surrounding tissues, stimulating nerves and causing stinging or itchiness, which feels different from typical inflammation or hemorrhoids. Consider Mr. Ryan, a 76-year-old who had dealt with hemorrhoids for 3 decades. When he first felt itchiness around his anus, he naturally assumed it was just a hemorrhoid flare-up. He told me, "Doctor, I've had hemorrhoids since I was younger, so I know the symptoms, but this feels different. Usually hemorrhoids hurt when I sit or use the restroom, but this time it itches even when I'm perfectly still." He applied more hemorrhoid cream and took frequent sitting baths, even underwent hemorrhoid surgery, only to be told everything was fine. Here's a way to check yourself. Pay close attention to the exact area of the itch. While hemorrhoids or common inflammation cause general discomfort, cancer-related itchiness often concentrates intensely in a specific localized spot, often described as a feeling of needles. The severity and pattern are also distinct. Normal inflammation-related itch usually improves with time and treatment, but cancerous itchiness worsens, especially at night. Mr. Ryan noted his itch was almost unbearable when he lay down, making sleep difficult. Also, look for accompanying symptoms: bleeding during bowel movements, changes in stool consistency, discomfort during urination, or changes in the color and smell of discharge in women. Importantly, assess the treatment response. Normal inflammation responds to appropriate creams or sitting baths. In the case of cancer, these treatments will not only fail, but the itchiness will likely worsen over time. It's crucial not to delay a checkup due to embarrassment. Early detection is paramount. Many, like Mr. Ryan, might ignore symptoms, assuming they're linked to a pre-existing benign condition. Is anyone here experiencing persistent discomfort in these sensitive areas? Finally, let's cover 6. The hands and feet. If the palms of your hands and soles of your feet are exclusively itchy, this could be a crucial signal of internal cancers. Toxins released by cancer cells can travel through the bloodstream and affect peripheral nerves, leading to itchiness specifically in the fingertips and toes, and on the palms and soles. This symptom usually appears when the cancer has reached a certain stage, so it demands attention. Mr. Allen, a 70-year-old gentleman, greatly surprised me. Only the palms of his hands were itchy. He initially thought it was housewife's eczema and sought treatment from a dermatologist. He recounted, "Doctor, I wear gloves when I wash dishes. I even switched to mild soap. Why is it still like this?" He was meticulous with care, applying lotion 5 to 6 times daily and even sleeping with cotton gloves. He speculated he was washing his hands too often, so he limited it to once or twice a day, using only lukewarm water. What was truly strange was that the backs of his hands were perfectly fine. Only his palms, especially the lines within them, were relentlessly itchy. Here's a simple at-home check. Closely examine the soles of your feet and the palms of your hands. With cancer-related itchiness, the skin color might take on a subtle yellowish tint, and the lines on your palms and soles might appear deeper than before. In Mr. Allen's case, his palms were indeed slightly yellowish. The itchiness pattern is also distinctive. Usually both hands and feet are affected. It worsens at night, but often improves during the day. The response to relief methods is different too. For normal skin problems, moisturizing or soaking in cool water usually helps. But these methods offer no lasting relief for cancer-related issues. Any coolness is temporary and doesn't resolve the underlying problem. Many mistakenly attribute this itchiness to a common skin problem, diabetes, or poor circulation, often dismissing it as part of getting old. However, if only the fingertips, palms, or soles are itchy, you must consider abnormal peripheral nerves or systemic diseases. If you're over 60 and experience this specific type of itchiness for more than 3 weeks, a comprehensive medical checkup is non-negotiable. Have you noticed any strange sensations in your hands and feet lately? Now let me quickly share 5 essential self-diagnosis steps that can help you catch these issues early. Just remember these simple steps. The 3-week test. If any itchiness lasts for more than 3 weeks, it's not a simple, everyday issue. Normal skin problems or allergies typically clear up within 1 or 2 weeks. Mark your calendar. If it extends beyond 3 weeks, it's time to visit your doctor. The lotion response test. Apply moisturizing lotion or anti-itch cream 2 to 3 times a day for a week. If it's merely a skin problem, the itch should improve. If it doesn't work or surprisingly gets worse, you should strongly suspect an underlying internal issue. If external treatments are ineffective, the problem isn't just on the surface. Check for side symptoms. Itchiness rarely comes alone when it's serious. If you've unexpectedly lost 3 to 5 kilograms, around 6 to 11 pounds, in 1 month, feel constantly tired, or have a persistent low-grade fever, alongside the itchiness, these are strong indicators of an internal problem. Get a checkup sooner rather than later if you have these accompanying symptoms. Itch pattern analysis. It's crucial to observe when your itchiness gets worse. Cancer-related itching frequently intensifies at night and tends to be less bothersome during the day. Also, pay attention if the itchiness consistently affects a specific spot, rather than alternating or moving around different areas. A constant, localized itch needs careful consideration. Family history check. If your parents or siblings have a history of cancer, your own risk can be 2 to 3 times higher. You need to be especially diligent if you experience symptoms related to the same type of cancer. Never ignore small signs if there's a family history. Frequent checkups are your best defense. Confirm these steps one by one. Thank you for listening to this comprehensive message. Let's quickly summarize everything for clarity. First, revisit the 6 dangerous areas for itchiness. If your lower legs are persistently itchy, especially if it worsens at night and creams don't help, check for lymphoma. An itchy spot in the middle of your back, particularly if accompanied by poor digestion after fatty foods, may signal early pancreatic cancer. Itchiness of the scalp or behind the ears, especially if shampoo changes are ineffective and it's worse at night, might warrant a blood test for leukemia. Persistent itchiness near the chest, perhaps with skin texture changes or redness on one side, could indicate inflammatory breast cancer in women or men. Constant itchiness around the anus or reproductive organs which doesn't respond to usual treatments and worsens over time needs a check for anal or vulvar cancer. Never let embarrassment delay seeing a doctor. If only the palms and soles are itchy, particularly with yellowish skin or deepened palm lines, and other symptoms are present, it could indicate internal cancers. Remember the 5 self-diagnosis steps. The 3-week test. An itch lasting over 3 weeks is not simple. The lotion response test. Suspect internal issues if creams don't help after a week. Side symptoms. Fatigue, fever, and appetite loss are highly connected to systemic diseases. Itch pattern. Worsening at night and affecting the same spot are key indicators. Family history. Be especially vigilant with regular checkups if cancer runs in your family. Not all itchiness signifies cancer, but all cancer often begins with subtle signs. Please don't just brush things off as old age. Listen attentively to the signals your body sends. At 88, I'm still seeing patients because I truly know that these small signals can save lives. My 50-plus years of experience have taught me that most cancers are treatable and even curable with early discovery. Here's something powerful you can do tonight. Before bed, take a few moments to check your body. Note where you might be itchy, when it tends to be worse, and how long it's been going on. Mark it on a calendar and keep a clear timeline. If any of the symptoms I've mentioned match what you're experiencing, please don't hesitate out of embarrassment. Go see your doctor. Be sure to describe precisely when the symptoms started, their pattern, and any other accompanying symptoms you've noticed. Your health is the most important thing you possess. Money and fame pale in comparison. Let's make watching this video the very first step towards safeguarding your precious life. In our next video, I hope to share more warning signs behind other common symptoms often associated with old age, such as joint pain, poor digestion, and headaches. There's so much to be careful about. If you found this information valuable today, please show your support by liking this video, subscribing to my channel, and hitting the notification bell so you can receive more vital health information quickly. And most importantly, share this video with your loved ones. I sincerely hope everyone stays healthy. If you start making these changes now, imagine the more healthy and energetic life you could be living next year.